On to the presentation. Every minute of every hour of every day, individuals in the United States suffer from mental health issues. These people lack the same good information on access to services and receiving treatment that those who suffer from a physical ailment like diabetes and heart disease have available to them. What's the problem? And perhaps more importantly, what's the solution? Dr. Benjamin Miller, the Chief Strategy Officer for Wellbeing Trust, will present his findings and recommendations on a national and local level for addressing these two questions facing America and our own Boulder community. Please welcome Dr. Benjamin Miller to Boulder Rotary.
All right, so let's start with an exercise. I can tell y'all are a lively crowd, especially on a Friday afternoon, so let's do something kind of fun for a minute. Everybody take out your cell phones. I know people usually say put them away. Take it out, and if you're by yourself, this won't work for you, Hans, but unlock it, and then hand it to the person to your left. Okay, thank you. All right, I just for a moment, process this with me. How did you feel in that moment I asked you to do that? Yeah. It's a little unnerving, right? Now, so I want to actually apply this to what I'm going to talk about the rest of my time here, which is when we have something that's so intimate to us, and we want to talk about it, but we don't know how the other person's going to handle what they might see on the phone or what they might say back to us. That right there is the problem that our country's facing right now for mental health. Good, we got this one on. And I cannot stand behind a podium to save my life, so I'm going to walk. We've gotten to this place where we're a little too uncomfortable sharing with each other issues that are really intimate. That's really loud. Let me turn down just a little bit. There you go. Thank you. And so what I want to try and posit today is that if we're going to try and change the trends in our country around mental health, around addiction, things around suicide, we're going to have to become comfortable unlocking our phones and handing it to the person next to us. Not literally. But you're going to have to be comfortable talking about this at the dinner table with your kids. Or when you go to work and someone says, you know what, I had a really bad week last week and I did something I shouldn't have done over the weekend. How we respond to each other changes our culture. And I don't want to point fingers here, but we've just gone away from that. And I don't know where it happened or when it happened or any of that. But I do know that we're currently living in a time where people are hurting. So let me tell you briefly just a little bit about context. So 1993, think about what you're doing in 1993. I was in high school, and I fell in love with this concept of healthcare. Because at the time, and if you're a policy wonk like me, and this explains a lot about me, I actually got a C on this paper, so if that tells you anything. This was during the Clinton administration, and it was at the time of Clinton Care, and so there was the kind of one of the most recent at that time attempts to reform healthcare. And I was looking back through this paper, and I was reading some of the things that I highlighted as an issue, like why we needed health reform. And I got to tell you guys, if you look at 1993 and you look at 2020, there's not a lot that's changed. And if you go back in time, and I love to look at history here, almost every single United States president has declared healthcare in a state of crisis or emergency since 1952. Here we are in 2020, and yet we're still in the middle of a crisis and an emergency. What are we going to do about that? Well, I believe that fundamentally one of the things that we failed at fixing along the way of this journey of healthcare is that mental health piece. And so I want to talk a lot about that today, especially what you can do. And I'm going to do it pretty quickly because I want to get to some questions that we can talk together. All right, first of all, let me call out the elephant in the room. There are always going to be politics in our discussions around healthcare. We do a lot of work nationally, and one of our partners in D.C. is called the Bipartisan Policy Center, and yes, bipartisanship apparently is still a thing. You may not see it in real life, but there are centers that work towards this. And if you look at these data, what you can see is just we sometimes agree, if you're a Democrat, Republican, or Independent, on certain issues, but then there's major issues that we fundamentally disagree on. And how we can come to a place that we all understand what that collective one thing is that we can do to make a difference in healthcare is our challenge. And we haven't quite figured it out yet. This is what we've got, though. So we've done a lot of workarounds in this country. So we've started thinking about, okay, well, we have a lot of people that are uninsured. How do we cover them? We've started thinking about, okay, well, this mental health thing is a problem. Let's put more money into it. But we haven't really fixed the total issue here, which is that we've got a broken system that someone, somewhere, somehow is going to have to undo and make right. If you look at the data again, and there's some great studies that have come out even just in the last few months on this, we spend a whole lot in this country, and I know you've heard this before, we spend more than any other industrialized nation on healthcare, and yet we have some of the poorest outcomes. Life expectancy in the country has declined 3 years in a row. And if you look at the paper that came out in JAMA just a few months ago, it says it's not just because of one thing, it's because of a multitude of things, but what should really terrify us is that it's social issues, like I already started talking about, our inability to really be there for each other in social factors. It's economic issues. Millennials right now are more likely to be in debt or poverty than any other demographic. And then it's health-related issues. We're increasingly unhealthy, whereas in years past, we were a little healthier. These are data that should wake up everybody in this room. These are data from the CDC, the Centers for Disease Control, and they look at trends from 1999 to 2017, which is the last available data. And what these data show you is that we've had an increase in deaths to drug, alcohol, and suicide every year since 1999. That's actually the first year that the CDC started collecting data on deaths that were preventable in nature. And so when we look at this, it should terrify you because it's going in the wrong direction. With the science, with the healthcare, everything that we've got right now, you would think that we would be doing a better job preventing death rather than seeing it increase. But it's not. It's going in the wrong direction. And if you really want to be concerned, which I hope I'll get your attention on this point, our youth. So the youth in this country, we've seen an 87% increase in suicide the last 10 years in youth. Colorado's had a suicide problem for a long time, and some of you in this room may have been affected directly by that. Okay, our nation, as I said, is hurting, and so the solutions is that we have to heal. Healing comes in rooms like this. Healing comes in your communities when you're able to talk to your neighbor or you're able to talk to your coworker and really address things that matter to them. Healing also comes when we can provide meaningful solutions to people in the time and the place that they're asking for help. That's what we failed in healthcare. So I drop a lot of F-bombs in rooms like this. I talk about fragmentation, I talk about being fractured, and it's true because we've fractured our mind from our body, we've fractured the health system from the mental health system, and we, as people in our community, are kind of stuck in the middle. If you look at the trends where people are dying more prematurely, you can see almost everywhere is doing poorly. And I only highlight this to show you that, Colorado is kind of right in the middle, but then we've got neighbors to our south that are hurting in pretty significant ways. And I know you all as a community that's both kind of international, or local and international, you've got friends that are all over the country that when you see things like this, you might think, well, what are we doing to help our people in West Virginia? I'm afraid, and these new data come out January 30th, and we've already been told that it's only going to show an increase again. So, my friends, this is our call to action, and while you get a lot of people, I'm sure, that talk to you about things that you need to do, I have to tell you that this is an easy one for us to fix because it begins with you and what you say to everybody that you talk to around issues of mental health. I skipped that. That's too busy a slide. Okay, so let's focus on why I'm here to talk about today, which is mental health. And so this was a cartoon that was in the New Yorker a few years ago, and I actually think it's very appropriate because when you think about getting access to mental health, it's not easy. If you want to go see your primary care doc because your knee hurts or you got a cold, it's relatively easy for most people. But if you ask about individuals' experiences all across the country, one of the things that they will tell you is that they're scared to go here because they don't know if they're going to have insurance that's going to pay for their care. They're a little terrified as to what happens when they have to open up and talk about what's really bothering them. And then most importantly, they have no idea what happens inside this building. And if you are I'm a mental health clinician, I'm a psychologist, so if you think about, if you're a clinician, you kind of know what it's like. If you're new to this world and you've only watched TV or heard things from other people, you probably don't want to go inside that building if you can get inside the building. What's interesting is that the data show that we are seeking out care more. So this is one study that showed that we've increased the number of times that we go to a mental health visit. So we're actually doing something right by being able to finally go and see more of our mental health clinicians. But what's interesting is if you look at the data, it's the younger populations that are not going. And why is that? Well, let's talk about culture for a second, and let's talk about the culture that we've built. So let me show you a cutesy little video here.
Listen, I know you're sick and all, but are you even trying to get better?
Hey, look at it this way. There's plenty of people out there that have it worse off than you do.
You need to stop focusing on all the bad things in life and just try to enjoy it. It's all in your head.
I don't think you need to be taking medication every day just to feel normal. Don't you think it's changing you?
Listen, you really just need to suck it up. Like, everybody goes through this and you're just feeling sorry for yourself.
Why don't you just go to the doctor?
I can't. My insurance doesn't cover the flu.
Steven!
Hey man, that's broken. You need to see a doctor.
Seriously, I'm fine. I can get better on my own.
So I realize that's a little bit kind of tongue-in-cheek there, but if you think about it, we do this all the time. We do it all the time, where we may not understand that someone that is suffering from depression, that they can't just wake up and be happy, that they may have an amazing house here in the foothills, and they can't just wake up and think, wow, I'm blessed to have this. It's a disease, and it's something that affects us all differently. But what we do as a culture and a society, and we've seen this a lot in our youth, is that they're trying to change the way that we talk about mental health so that we don't just do what you saw in those videos, which is pretend that it's something that is just non-existent. Just get better. Just kind of suck it up. You'll be all right. The solution to this, as I mentioned, begins with you, but because I'm a policy guy, I want to talk a little bit about what people have to experience every day and ways that we can begin to connect some dots to change it. So on a typical day for someone encountering the healthcare system, this is usually what happens when it comes to mental health. You've got something that occurs. I got arrested. I completed a form in my doctor's office, and they said I might be depressed. You know, I showed up for work, and I was intoxicated, whatever. Whatever it might be. You enter into the healthcare system because of some event. Okay, rarely do we just say, I think I might be depressed, and I'm going to go seek care. Usually something happens. And in this case, most of our actions are to refer people to the mental health system. And our mental health system does as great a job as it can. But what happens when everybody's referred to mental health, it takes a little bit longer to get in. So there becomes a backlog of individuals seeking care, which means that those folks have to be pushed back out into the rest of the healthcare system, which is usually primary care or your emergency department. This is not a tenable solution when you're in a crisis. Okay, but it's also something that people experience over and over and over again. So let me show you kind of the irony of this. We want more people to go here, but when there's not enough resources here to provide meaningful support for folks in a timely manner, they come back out here, and then they get mixed up into all kinds of other places. So if you're in a school and you're a child, and you show up and you say, hey, I want to talk to somebody because I feel like I'm a little too anxious, that school may not have the resources to take care of the kid. And if they do, it's immediate referral. And so you perpetuate this cycle within the system. How do you fix this if everything is so fragmented and they've got their own ways to communicate, they've got their own ways to measure, they've got their own payment mechanisms? How do you solve this problem? Well, it begins by, first of all, recognizing where people show up for mental health in the first place. And that's typically in primary care settings. So this is a study we did a few years ago. It's been replicated now over and over again. But most individuals, when they have a problem for health, which includes mental health, they show up to their primary care practice. And I know there's some primary care docs in the room, so you've probably seen this over and over and over again. Okay? This system, though, is not typically situated or prepared to manage individuals that have a mental health crisis or just have mental health needs. This study shows that when you look at individuals that had poorer mental health, that most individuals are showing up here. Rarely are they making their way to the mental health system. And that's because if you are having a tough time with depression, let's just pick on that one for a minute, and you show up here and they say, you know what, we would love to help, but you're going to have to go see somebody else. And when that moment where they say you have to go see somebody else, and it takes a week or 2 weeks or however long it takes. 96 million Americans had to wait over a week last year to see a mental health clinician. So we know it takes some time, and a week is good in most states. You may go home and you may not have the motivation to go back out. You might decide you just don't want to talk about that again because it was so painful to begin with. You don't want to encounter anybody and share your story again. There's a lot of reasons. So the solutions for this begin by saying, okay, well, people show up in primary care, but we also spend a ton of money because we don't address mental health properly in these healthcare settings. And any actuaries in the room, just curious? Okay, any child psychiatrist? This is a good game to play when you're out there on the circuit. I always ask those questions because those are the two people you should always hug because there's not enough of them usually. I mean, you may say, well, why not actuaries? We don't need more actuaries. Well, actually, we kind of do because they are the ones that policymakers listen to because you can see how much money you're going to save or make. Child psychiatrists, just for obvious reasons. So we spend a lot of money on mental health, but yet we're still getting the same type of outcomes as before. So the solutions come back to why we need to integrate. Now, I'm going to really nail this one. So we look at primary care as one example. 2/3 of primary care clinicians report that they can't get access to mental health for their patients. But yet we know is that almost 1/4 of all primary care visits are about mental health. So follow me here on my logic. With half of us, I usually say all of us, experiencing some type of mental health or substance use need in our lifetime, that means that 3/4 of us almost get nothing for care. And if you look at our youth, most of them are seen in pediatric settings, and that's it. So right here, I can make in one slide a compelling case as to why we need to think of different ways to integrate mental health. But yet, we're slow to do this. Nationally, what percentage of primary care practices do you think screen for depression? Take a guess. Any number. 60? 8? Others? Close. Whoever said that is 4.2. 4.2%, to be totally accurate. And the funny thing about this is that we actually incentivize primary care to screen for depression. We pay for it. So why don't we do more of it? Well, a lot of this is the culture piece. A lot of this is like, well, what am I going to do when I find out that someone is depressed? And there's still, my grandfather was a family doc in a rural part of East Tennessee, and he used to say he never understood why I became a psychologist. He was just like, I don't even know what that mental health thing is. He couldn't accept that it was a real part of health. Now, that's a different world, a different culture, bygone era. But still, it speaks to the fact that we have this culture that does not think mental health is a part of the healthcare system. So how do we get to a place for an integrated revolution? Okay, well, it begins by, first of all, recognizing that we have a problem with fragmentation. I've already said that. Second of all, it begins by changing our narrative, which I already talked about begins with us. The third thing is really where I spend a lot of my time, which is here. That if we're serious about enhancing the overall mental health and well-being of our communities, it actually begins in the community. As I said, I wasn't joking when I said it begins in rooms like this. Because when we look at the things that really are vital for our overall mental health and well-being, it's a lot of things that we don't typically talk about in healthcare. It's how much are we, able to engage civically in our community? How much do we have consistent transportation to get back and forth between the places that matter for us? Remember, not everybody's got a car. How do we have housing that is safe and secure so that we're not going to bed every night worried if someone's going to be knocking on our door at 2 in the morning? There's a lot of factors that we would call vital conditions that are essential for communities to grasp and own if we're serious about pushing forward a more positive mental health and well-being agenda in our communities. Then there's the kind of the boring stuff that policy wonks like me talk about all the time, which is coverage. So health insurance. Now, I know that health insurance is important, don't get me wrong. But if I were to ask any of you to explain your health benefits, how many of you think you could? Okay, a few of you. Now, let me double down on here. If I were to ask you to explain how your mental health benefits work, how many of you think you could? Right, nobody typically does because it's become this black box that we don't understand, either because we've never asked or we've never used it, or frankly, it's just so darn confusing. This is another talk for another day, but I love looking at medical bills. And those of you that might be in the industry probably geek out on this like I do. Medical bills are some of the most fascinating documents I have ever seen. Because if you can explain a medical bill to me and you can actually tell me what you paid for versus what the health insurance company paid for versus who knows who's paying for it, then you're a whole lot better than I am, because we struggle with that. So we've got to figure out a way to cover mental health at parity, which is the technical term, for at the same level as your physical health benefits or your medical surgical benefits. We did a study last year that looked at the last 10 years. So there was a law passed in 1998 in Congress that said, okay, if you have health insurance in this country, for most health insurers, you have to have the same level of mental health benefits as the same level as physical health benefits. That means out of pocket, that means co-pays, that means number of visits, that means a lot of things, same. And 10 years later, we did a report card analysis of all the states. 3/4 of our country failed at enforcing the congressional law, the federal law. Well, why is that? It's because we don't understand it. It's so complicated. Another history lesson. 1963, John F. Kennedy signed into law one of the first, most influential pieces of legislation around mental health. He said, we got to deinstitutionalize mental health. We got to put people back into community and get them out of the hospitals. And the reasons for that were good. There were some studies that were done that said we can manage mental health conditions with medicine, with therapy, but we can't manage it if we keep people in hospital locked up. 1963, okay? 2020, we still have not realized the vision that President Kennedy put forward, because a lot of things happened along the way in that journey that I told you, that we did not invest the adequate resources to support folks. So we're living in a world that created benefits in 1963 that we still don't understand in 2020. We're living in a world that we created a system in 1963 that has never been fully invested in. And I can go on and on and on. Engagement. As I mentioned to you, from a policy perspective, what we typically do is we say, okay, we need to do a better job addressing policies in healthcare. So it's at the top of the continuum. But what we do also have to figure out is how we can address it in our places of employment, our court systems, our education system, and our communities. If you want to see where most people are who need true acute mental health, it's not in the hospital, folks. It's in our jails and our prisons. And if you, I worked in Kentucky in a prison for over 1.5 years, and I can tell you, it's some of the most challenging conditions to heal that I've ever been a part of. Despite having some resources here and there, if you haven't spent any time, hopefully not personally, but maybe just visiting, you can see that it's a tough place to really recover and to get support. But yet we have people housed there because there's no acute psychiatric bed for them, because there's no place back in the community for them to go. And I have to say, I've done this stuff all over the world, and I was in Johannesburg last year, and there literally are places where people are just locked in rooms because the community doesn't know what to do with them. Now, I don't want to say that we're as bad as that, but truly, it's almost as bad if you go to some of our prisons and jails. We have to figure this out. This is a policy thing that needs to be done, but it can't be done in isolation. It has to be inclusive of all the other variables there in our community. And then last but not least, what are we trying to get? Well, if we don't have outcomes that we're looking for, which is things that matter to you, really, not matter to me, do you feel more productive? Do you feel happier, healthier? Are you satisfied with your life and your overall well-being? The most important measures that we could ever ask are measures that we never usually use, and they're measures that matter to you. This is our future, folks. Figuring this out, I know I've been working on it for my career. Some of you in the room have been working on it for your career. This is not going to go away. A new administration is not going to fix everything. It doesn't matter what it might look like. It doesn't matter who might be in office. What matters is that we recognize that the solution to the problem of fragmentation is only going to be found through comprehensive community and clinical integration. I lost my clicker here. I'm going to have to just click it for me if you don't mind. It's a good thing this talk wasn't on technology, because that would be just a cruel irony there. Can you click? Is it frozen there? There we go. Thank you. All right, keep going here. See how we do together, Fred. Oh, it's working again. Okay, so let me talk about 3 issues as we wrap up here, and I want to get to some questions here. First of all, the issue of workforce. Now, I put workforce into 3 categories, and I've beat this one to death already. So the first one is the community. That's you. Every one of us who is not in the clinical world has a role to play when it comes to addressing mental health. That is knowing how to talk about it. That means going to trainings that are going to happen this afternoon so you can recognize issues that happen in your friends or your community. It begins with us. Okay, the unlicensed or just kind of general workforce is the front line of addressing so many of the mental health issues. The second is the current workforce. And when we think about who's out there, there's a lot of people out there, especially in the mental health workforce, that's just in the wrong places. We've got a lot of folks that work in certain locations where people don't show up. What happens if you took the current mental health workforce that exists everywhere in Colorado and you distributed it to schools, to those prisons that I talked about? You put it in the places that people get their hair cut. And you want to talk about a good place for therapy, I'll tell you right now. I guarantee you most of you in this room have said more to your hair salon person as you have to other people in your life about your own emotional health. Okay, it's true. I don't even have much hair to go. I just go to talk and get my beard trimmed. Because, I mean, he's a guy who I lean into, okay? We've got to be thinking about putting our clinicians in places that people are. And then the third is the future workforce. So those of you that are educators or might be working, at the college or wherever. I worked at the medical school for a long time. I mean, we've got to be thinking about how to prepare the future generation of workforce for the system that we want, not the system that we have. That requires a lot of curriculum development. That requires a lot of shifting in our vision of what healthcare is and is not. But we've got to think about workforce differently. So I want to show you a cute little video real quick. We worked with our friends over here at Vermilion, just in your backyard, on this project called Make Health Whole. And this was our attempt to try and take the current mental health workforce and say, you know what, if we just shifted a little bit about what you're doing, you could actually make a huge difference in places like primary care. So let me show you this real quick.
Maybe you're new to integrating behavioral health into primary care and want to develop the necessary expertise. Maybe you're already delivering integrated primary care, but want to deepen your abilities. Wherever you are in the process, it's important to have the right skills for the right settings. The 8 competencies can help, but before we get into how to use them, let's take a step back. How did these competencies come to be? And more importantly, how do they improve our fragmented system? In 2015...
That's the wrong video. I was like, what's he talking about? Okay, well anyway, let me tell you what he was supposed to show you. I mean, it's the same guy. It's just the wrong video. Goodness gracious. And what's really funny is that's one of my mentors, and so I get to text him on the way home and tell him I just embarrassed myself with his video. So what that was supposed to show you is that when you have the current workforce and you give them exposure to a different culture, like a medical culture in the mental health world, it's a rising tide raises, that's right, all ships or boats, depending on your culture there. And that you can actually elevate the comfort level of individuals talking about mental health by bringing mental health into places that it's typically not discussed. And that's what he was going to say in a much more eloquent way than I did. So now that I totally messed that one up, let's talk about money. Okay, so when it comes to mental health, one of the most important things that everybody always says is the reason we don't do what's right is because of financing. Okay, they talk about, well, we don't get paid enough or we don't have the resources to do that. We did a study in Western Colorado with Rocky Mountain Health Plans. Some of you may be familiar with them. And all we did was we said, we want to compare 2 different payment models. And if you're totally academic and wonky, you can read the article. I'm going to give you kind of the bumper sticker on this one. And we paid the primary care practice to include the cost of mental health to see if they would treat mental health differently. And lo and behold, they did. Not a shocker, right? But what was cool about it is because of how we paid them, and we didn't pay them in a traditional healthcare way, we just gave them a pot of money and said, manage your budget, we saved a ton of money. Now, 4.8% for you may not be much, but in the time frame that we used this study, it was a little over $1.2 million in less than 18 months. That's a lot of money to save just by paying for things that are right. So financing is not the crutch that I believe that people, make it out to be. What's interesting is that most of what we know costs us so much in healthcare is the fact that we do not address mental health in our chronic disease population. So this is a study that was done by, again, the actuaries who are not in the room, to show that if you do a better job looking at mental health and physical health simultaneously through that integrated model that we've been talking about, you can save in the billions annually. in the billions. Now, when you have $1 trillion healthcare system, you may say, well, billions is not much, but actually this is a substantial amount of money. So when I can go from the micro level and show you, I can save 1.6 million by just doing what's right in primary care, to the macro level across all payers doing a better job addressing mental health, this becomes one of the most fascinating business cases that no one talks about in the healthcare industry. Well, maybe some of you in the room do. Policy. My world. Okay, so next Thursday, we're launching a report. I told you that the solution to the pain that we're feeling as a nation is through healing. So we're releasing a policy guide for Congress called Healing the Nation. And it's going to come out January 30th, next Thursday, assuming everything goes to plan. We've got an event in D.C. the week after that. Why do I tell you about this? Because for me, I feel like the narrative on healthcare, especially around mental health in this country, has focused too much on coverage. Every time you turn on the news and every time somebody talks about this, it's about health insurance, this, Medicare for all, that, et cetera, et cetera, et cetera. Rarely do we talk about how to heal as a nation. And this is a much more challenging conversation. It's one that is grounded in some of the historical trauma that communities have felt. It's grounded in pain and suffering that we still feel by losing a loved one and not knowing what to do about it. Trauma exists at multiple levels. We've got to learn how to heal. Until we are able to do this, I'm afraid, my friends, that everything else is just tinkering at the edges. So our guide, and you may say, well, how are you going to put healing into a guide to Congress? I mean, they need to heal themselves. It's probably true. But we lay out policies based upon that framework that I showed you just a minute ago on how we can do a better job addressing mental health in our schools, in our criminal justice system, and paying attention to issues like poverty and housing. Things that are tough to talk about, but are the right things to talk about. So I want to close with a story, and this is a little bit of a tough story to watch, but I want you to kind of just process this for a minute, and this is actually from here in Colorado.
Healthcare, it should be everything. If I didn't have a behavioral health and a primary care physician that work together as a team, then I couldn't tell you where I'd be right now, actually. I enlisted in 2003, the day I turned 17. I was so determined to serve my country and become strong and earn that title. I was caught with steroids in my equipment about 3 months before my full 6-year term was up. But the discharge that I was given, other than honorable, gives me no medical benefits. And I have to find my own ways to get those services. I have a plate and 4 screws in my hand. I fractured my hip, surgery in my right ankle, blew my knees out, blew my back out, rheumatoid arthritis disease. The military diagnosed me with severe anxiety, severe depression, personality disorder, memory loss, PTSD, insomnia. I was taking 23 pills, I think, a day. Everything was starting to get worse. I continued to buy more painkillers so I can be able to go to work. I was losing weight. I was getting real skinny. I just felt like a zombie. And then it gets worse from the pills and then the divorce. And during that time, I go homeless, living in a van, to standing on a corner of a street with a sign. Everybody drives by people like that every day. And I tell myself, I will never, ever do that. And I got there. I was like, I'm done with this. I'm a United States Marine, and I don't feel as a man as I thought I used to be. I looked at that heater and I was like, I'm just gonna kick on that propane and not even light it. I won't wake up again. And then I started thinking about my son. I just wanted to see him grow up and know he had a strong dad. And I decided to quit cold turkey. I didn't want to have something controlling me. I wanted to be able to rely on myself. I was looking for a place because of my pain. I needed to see a doctor, so I found Salute online. I went in one day and I was having anxiety, depression, and the doctor noticed it and they said they were gonna go get somebody for me to talk to. and that was the behavioral health side. A lot of the things and techniques that we worked on, you would think are common sense, from sleeping to exercise to my nutrition. I was speaking with the mental health, and then I had a physician there that I was seeing as well. I felt that I had a team behind me. Having it all under one roof helped me recover faster. It's helping me build back up to who I was. I'm a heavy equipment operator. I'm going to work every day. It makes me feel good knowing that my son Caleb's laughing all the time and has things he needs when he's with me, and that tells me he loves me. Feel like he knows I'm his dad, and I'm gonna take care of him. I'm not down that hill yet. I'm at the top right now almost, but having my mental health under control and being clean, I feel like I've succeeded in something. I'm moving forward.
So when we think about it, that could happen to any one of us. And it does every day, stories like this. It is up to us to figure out how we can provide meaningful solutions to people like him, but also just to our families and our friends. I take this work very seriously because I think that when you've lived on the front lines and you've experienced this either personally or professionally, you know how important it is to get mental health right in our communities. And so my challenge and kind of my takeaway here to you, and something I hope you take away, is that when we begin to change the language that we use to include mental health in all our dialogue, we change the culture of health. We make it a normal thing to discuss. We make it possible for people to heal. And most importantly, we give people a safe space that they feel like they can belong. Without that, again, I just don't know if we're truly going to get to that place as a society where we change some of those horrible numbers and trends that I showed you at the beginning. When people hurt, they want to be taken care of. What role will you play in your communities today to help take care of those people for tomorrow? You don't need to be a clinician. You don't even need to know all the answers to all the questions. Being there, being listening and supportive goes a mile for so many folks that are in pain. So let me pause, show you some resources, and see if we have any questions. I think I'm at my time anyway. Thank you. All right, in the back, I see you. Stand up, yell. Oh, microphone coming.
So I have an observation and a question.
Yes.
And observation is from my experience with my doctor. It was 10 years ago where my doctor wanted to give me antidepressant medicine. Mm-hmm. And no tests were done. Nothing was really done. And I was given a medicine. I said, I'm not going to do that. The same thing happened with my wife a few months ago where she was given antidepressant medicine. Mm-hmm. No talk of eating healthy, exercising, getting involved with community, none of that. So I do see that's one problem why people don't go to doctor, because they feel like they will not be diagnosed properly. Mm-hmm. So that's one. And the question I have is about IT side of things. Technology should be able to integrate. Ideally we should have one record for one person that has every interaction with every service they use, with every department, every interaction. Estonia has done it already, so is there any progress towards that?
Yeah, okay, first of all, thank you for your observation, and I think there's many of us in this room that have probably experienced something very similar to what you described. And it is unfortunately a byproduct of us not doing a great job of identifying and treating properly, so thank you for that call out. On the IT side, so the information technology side, if you're an HIT geek, health information technology geek like me, you'll appreciate the question, because as I described fragmentation in delivery, so too exists fragmentation in data. And a lot of this stems from the fact, and my mental health center friends in the room can speak to this, mental health centers were not given resources to really build up and enhance their HIT infrastructure the way that medical was. And a lot of this is a provision of the ACA, and actually it's called the High-Tech Act. It came after that. And it incentivized medical practices to adopt electronic health records so that you had an electronic health record that you can use consistently. Mental health centers didn't get those dollars. And what they did do, they would scrape together whatever pennies they could to go out and find an electronic health record. And usually the ones that they found were not really great. And if they were great, the data and the ability to merge in some type of meaningful way does not happen. So you have data systems that don't talk to each other. You have different data fields that exist in totally different worlds. It just became a mess. So we are living in that world now where we still have fragmented data systems. Now, the ideal would be that you as the patient, we as everyone, would have access to our own data, right? Because why should a system just own those data? Those data should be ours to look at. That's the future, and I think that's where a lot of people are going, unfortunately. Healthcare is a morass of competing business interests, and so you've always got that working against you. We don't always do what's right just because it's better for the patient. HIT is going to be our struggle for the next decade, I guarantee you. So thank you for that. Yes, sir.
Dr. Miller.
Yes.
As Boulder Rotary Club, first of all, as a former primary care physician, I can tell you that I can certainly appreciate all the information you gave us, is both the perverse incentives that exist in the system and the lack of appropriate training that have to be rectified in order to address some of the things that you have talked to us about. But Boulder Rotary Club would like to offer you as a honor for honoring us with this talk today. We're going to donate 100 doses of polio vaccine to our Polio Plus Fund. So thank you very much for
thank
presenting.
you. Thank you.